without a little context. You could say, well, look at that. They're lying, but they're not.
Dr. David Hilden at Hennepin Healthcare wasn't surprised by a new report from the CDC last week that showed 94% of the patients who died from COVID also had underlying conditions, or at least one other factor that contributed to their death.
This was not news to any of us. It just simply affirmed, yeah, I could have told you that.
What was surprising to many doctors was how people reacted, with many on social media arguing this was proof that medical experts have been padding the numbers, exaggerating the virus. The phrase only 6% was trending on Twitter this weekend with more than 111,000 tweets.
It really does not at all mean that only 6% of the reported deaths were from COVID-19 and the other 94% died of something else. That is simply false.
Dr. Hilden says the other conditions are only listed because they played a role alongside the virus, like the virus caused cardiac arrest, respiratory failure, or pneumonia. All three are conditions on the CDC report. Or the virus exacerbated the patient's pre-existing condition, like diabetes or hypertension. He says the report doesn't downplay the virus. If anything, it shows how devastating it can be for people with pre-existing conditions.
This is confirmation that if you have underlying health conditions, you should double down on your preventive measures to try to prevent getting COVID-19.
Gordon Severson, KARE 11 News.
Right now, the death total nationwide is sitting at 161,000. The CDC report shows COVID was the sole cause of death in less than 10,000 of those cases.